All children need safe, stable, nurturing relationships and environments to thrive. However, families can sometimes face risk factors that adversely impact positive outcomes for children and can increase the likelihood of abuse and neglect. Efforts to address risk factors in a family and prevent child abuse and neglect from occurring or reoccurring fall into 3 levels: primary prevention, secondary prevention, and tertiary prevention. In this framework, we can think of prevention activities as a continuum where families may benefit from services at more than one level of prevention. The presence or possibility of risk factors helps to determine which level of prevention may be needed to best support and strengthen the family. The Office of Child Abuse Prevention, OCAP, has developed a resource that outlines this framework for preventing child abuse and shares activities and strategies for each level of prevention to reduce the likelihood of child abuse and promote healthy families and communities. Let's review each of the 3 prevention levels and recommended strategies. The primary level of prevention is aimed at all families, whether or not they experience any risk factors. Activities at this level of prevention are directed toward all families to strengthen communities and improve child well-being by focusing on family strengthening tools and resources, such as the 5 protective factors and the social determinants of health. Primary strategies may include reducing poverty and drug use, improving economic stability, increasing social connections within the community, improving health and access to healthcare, and improving school readiness and neighborhood safety for children. The secondary level of prevention is for families with 1 or more risk factors such as poverty, parental substance abuse, young parental age, parental mental health concerns, exposure to violence, and parental or child disabilities. Strategies and activities offered to families with 1 or more risk factors associated with compromised well-being or child maltreatment seek to build protective factors and mitigate the risk factors. Some of these strategies include increasing accessibility to family resource centers that offer information and referral services to families living in low-income areas, offering parent education programs in strategic locations, and providing home visiting programs that support and assist expecting and new mothers. The tertiary level of prevention addresses the needs of families where child maltreatment has already occurred. Activities for these families focus on reducing the negative consequences of maltreatment, mitigating trauma, and preventing reoccurrence. Tertiary strategies may include providing family reunification services and permanency planning, offering parent support groups or mentoring programs to families in crisis, and providing mental health services for children and families affected by maltreatment. In conclusion, preventing child abuse and neglect requires a comprehensive approach that encompasses primary, secondary, and tertiary levels of prevention. By implementing strategies and activities at each level, we can promote safe, stable, and nurturing relationships and environments for all children. Through collaborative efforts, community support, and the dedication of child and family serving professionals, we can work towards creating a society where every child can thrive.